This is a patient who presented following a penetrating injury with intraocular foreign body and had primary repair done elsewhere. So this eye is now following a vitrectomy and intraocular foreign body has been removed, but as you can see he has extensive loss of iris tissue from the injury. The plan here now is to implant one of the Morcher PMMA implants which has an artificial pupil, and I've started here by creating a Hoffman pocket at the 3 and 9 o'clock positions. A mini crescent knife is used to create a partial thickness depth at the limbus and subsequent dissection towards the conjunctiva to get a pocket into the sclera. Similarly, a pocket is created on the other side as well. The Hoffman pocket is a very nice technique which allows the sutures to be hidden following a scleral fixation of the intraocular lens. Over here you'll see using a 25 gauge needle in my left hand and passing a 9/0 Prolene with the needle and docking and passing it through from one pocket to the other. So this is a double-ended needle that's being used. So one needle is passed through first and the second needle is subsequently then passed through as well. And the idea here now is to exteriorize the loops and cut both sutures, and hence creating 4 separate ends which can be used to tie and fixate the eyelids of the Morcher implant. The implant is quite a large one here, and you see with the cut sutures the ends are actually threaded through those eyelids and tied appropriately. This is a relatively large implant and the corneal wound is enlarged to about 10 millimeters to fit the intraocular lens into the eye. There are various sizes for this implant in terms of the pupil, and we've decided to have one which is about 4 to 5 millimeters, as he's had previous retinal injury as well, and this would allow examination of his retina, and if should he develop further problems, surgery through this would be relatively easier as opposed to a much smaller aperture to view his retina. The corneal wound is sutured appropriately, and subsequently the lens is centered by pulling on the Prolene sutures gently. Following that, through the pocket the sutures are then retrieved and tied off to secure the implant. The tension on the sutures should be sufficient to hold the implant in place, but not too tight to pull the implant to one side or the other. Gore-Tex suture is not readily available to me at that moment, but would be an option as well, and perhaps there may be a less risk of future cheese wiring of the Prolene suture and perhaps dislocation. Sutures are cut short so that they are buried nicely into the Hoffman pocket, and as you can see here, the lens is well centered and looks very stable. Corneal sutures are buried, of course, and the anterior chamber is reformed, and the case is completed. This is how the eye looks on the first day post-op. Visual acuity is about 630, as he's had previous retinal injury, but this is a good result. Thank you very much for your attention.